Hello everyone, welcome back to my channel. It's your girl Ola. I want to say a huge thank you to my OGs, okay, for your support, and to my new subscribers. I'm very thrilled to welcome you to my channel. So guys, in today's video, I'm glad to be talking about care worker awareness on the importance of protecting themselves against viral infections. If you're one of those who have been planning to come to Canada to work as a caregiver, please gather here. As we all know, care workers play a vital role in society by providing compassionate care to vulnerable individuals, including the elderly, disabled, and those with chronic illnesses. Are you aware that this important job comes with an increased risk of exposure to viral infections and contagious diseases? Well, as a care worker, whether working in a healthcare facility or in a private home, your health is at risk from pathogens you may encounter while providing daily assistance to patients, clients, or even the residents, okay? This information is especially relevant to foreign workers planning to move to Canada through the Care Worker Pilot program. As we understand that the health risk on how to protect yourself is key to successful and safe work experience in Canada. Okay, guys, don't forget to like, share, and subscribe to my channel. We need to grow this channel, okay? Do you know why care workers are susceptible to viral infections? It is because they are often in close contact with individuals who may carry viruses or infections. Patients or residents in care may have a weakened immune system, making them more vulnerable to infections. And yes, they could be carriers of diseases without showing visible symptoms. Well, some of the common viruses care workers may be exposed to include influenza, okay, RSV, COVID-19, hepatitis A, B, and C, tuberculosis, and even measles and mumps, okay? Due to close contact with individuals who may be carrying these pathogens, care workers can become exposed to infectious agents. The risk increases during flu seasons or in the case of a viral outbreak, like such as COVID-19, where the transmission rate is higher. One of the most effective ways to protect yourself from viruses is through vaccination, guys. Because as a care worker, staying up to date on vaccines and immunizations is quite essential to not only protect yourself, but also the individuals you care for, okay? Vaccination boosts your immunity, reducing the chances of contracting or even spreading infections. It's important to prioritize vaccinations like, influenza vaccine, the flu shot. Okay, every year the flu virus changes and new flu vaccines is developed to combat the strains most likely to circulate the flu vaccine. Okay, it's a must for care workers. It is not only protects you from the flu, but also prevent the virus from spreading to vulnerable patients. Second on my list is COVID-19, okay? Given the global impact of COVID-19 pandemic, care workers are at higher risk of exposure to this virus. Vaccination against COVID-19 is strongly recommended to reduce the risk of severe illness, okay, hospitalization, and even death. Additionally, being vaccinated helps limit the spread of virus to others, including the individuals in your care. Next is hepatitis B vaccination. Hepatitis B is a viral infection that affects the liver and is transmitted through blood and bodily fluids. While the risk of exposure is lower for care workers compared to healthcare workers involved in procedures like injections, okay, it's still essential for care workers to be immunized against hepatitis B. Following is measles, mumps, and rubella MMR vaccine. These viral diseases can be severe, particularly for individuals with weakened immune systems. The MMR vaccine helps prevent these illnesses, which are easily spread through respiratory droplets. Next is tuberculosis, TB screening and vaccination. TB is a serious infection that primarily affects the lungs, but can spread to other parts of the body. In some areas, particularly in, let's say, developing countries, okay, TB is more common. Care workers should receive regular TB testing and vaccinations if applicable. Next is pneumococcal vaccine. Pneumonia is serious risk for both elderly and pneumococcal vaccines protect against infections that cause pneumonia, as we know. Okay, meningitis and the blood infections. Varicella chickenpox vaccine is like if you haven't had it as a child, like you've not been vaccinated as a child, you should ensure to get this vaccination. Chickenpox can be severe for individuals who are vulnerable due to age or compromised immune systems. Guys, if you are a foreign worker planning to participate in this Canada's Care Worker pilot program, it's crucial to understand the immunization, okay, the requirements and even the recommendations before moving to Canada. Canada has specific health standards ensuring that the well-being of the workers and even those they care for. So before arriving in Canada, you will likely need to undergo medical exam, which may include certain vaccinations depending, okay, on your country of origin and the conditions you will work in. Additionally, you should review the vaccine requirements, okay, for your particular role, and check with Canadian authorities or your employer for any mandatory immunizations for foreign workers. Ensure you are up to date on all vaccinations relevant to the Canadian health guidelines before traveling. Some vaccines like the flu shots may be available at clinics in your home country, okay? So it's worth making arrangements early. Consult with healthcare provider to discuss any specific health risk associated with your new working environment in Canada and how to best prepare. By getting vaccinated before arrival, you will help ensure a safe and successful transition to working as a care worker in Canada, protecting both yourself and your future patients from preventable diseases. So what are the key takeaways for today's video? Care workers they face higher risk of exposure to viral infections due to close contact with patients. Vaccines are critical protective measures to boost immunity and reduce the risk of contracting and spreading viral infections. Vaccinations including flu, COVID-19, hepatitis B, and MMR are essential for care workers. Foreign workers in care worker pilot program must ensure they are up to date on all required immunizations to comply with Canadian health standards and protect those in their care. Being proactive about your health and following recommended vaccination schedules will not only help safeguard your well-being, but also contribute to the overall safety and health of the people you're caring for. So stay informed and take the necessary steps to protect yourself and those who depend on your care. This is what I'm calling it a day today, okay? Thanks so much for watching. Please like, share, and subscribe to my channel. See you again in my next video. Bye.